Hello learners. Today we learn about factor modifying drug action. Factor modifying drug actions. So these are the number of factors which affect or which modify drug actions. Drug. First upon drug means or drug used in the treatment of disease. Drug obtained from various sources, plant sources, animal sources, mineral sources, synthetic sources, semi-synthetic sources, microorganism sources, etc. Mainly that is drug used in the treatment of disease or prevention of disease. So these are the factors which modifying drug action, that is age, sex, body weight, route of drug administration, time of administration, presence of disease, genetic factor, environmental factor, acquired tolerance, idiosyncrasy, rate of elimination, synergism, antagonism, tolerance, tachyphylaxis, and metabolic disturbance. So these are the list of factors which affect or which modifying drug action, that is age, body weight, route of administration, time of administration, presence of disease, genetic factors, environmental factors, acquired tolerance, idiosyncrasy, rate of eliminations, synergism, antagonism, tolerance, tachyphylaxis, and metabolic disturbance. So one by one we learn about that. That is first we learn that is age. This age generally small child and old people require small dose as compared to adult, because small child does not develop properly the organs that like metabolism organ, that is liver, and excretion organ, that is kidney, properly, and old people liver and kidney doesn't work properly. That's why the reasons metabolism, that is inactivations of drugs. When generally pharmacokinetics means study of absorption, distribution, metabolism, and excretion of drugs. So mainly when small child doesn't develop proper organs, that is liver, so the liver doesn't metabolize properly drugs. So this is small child factor effect, and old people also liver doesn't properly works. So that's why small people and old people, small child and old people require smaller dose as compared to adult. Second factor, that is body weight. So in that body weight, a heavyweight person require larger dose than normal weight person. Usually 70 kg is considered as normal weight of adult for calculating dose. According to weight of dose of drug varies. Higher the weight, higher the drug is required, but larger the dose is required. Third factor, that is sex. Some women do not always respond to the actions of drug in same manner as is done in men. So also special care is required in pregnancy. Also similar drug which may stimulate the uterine smooth muscle, purgative antimalarial drugs, ergotalkaloids are contraindicated during pregnancy. Also alcohol, barbiturate, narcotic drugs act on, but this is a contraindicated in pregnancy. Also during lactation, morphine, tetracycline are avoided. So tetracycline will avoided in during the pregnancy due to the bone defect or chelation of teeth will occurs, or mainly bone defect. So that's why special care is required during administration of drug in pregnancy woman. Then fourth factor, that is route of administrations. Route of administration directly affecting rate of absorption. So rate of absorption depend upon route of administration. Thus dose differ according to the route. It changes. If oral routes decrease the absorption, IV route have higher the bioavailability as compared to oral route. IV dose, intramuscular dose, subcutaneous dose, oral dose means absorption. Higher the absorption, higher the bioavailability, lower the absorption, lower the bioavailability. This is the concept. So route of administration affect rate of absorption as well as rate of bioavailability or rate of pharmacological actions. Higher pharmacological action, that is IV dose, intravenous drugs when given. So this is the fourth factors. Fifth, time of administration. If the drug are taken empty stomach, the absorption of drug is greater, but GIT irritation may occur. If drug taken after the meals, full stomach, absorption is lesser but no irritations. म्हणजे जेवणाच्या अगोदर जर ड्रग घेतला तर मोर absorption होईल आणि जेवणाच्या नंतर घेतला तर absorption हे डिक्रीज होईल. If the drug taken before the meal, but drawback, that is GIT irritation may occur if before the meal drug taken. After the meal drug taken, absorption is lesser but no irritations, means absorption decreases, rate of pharmacological actions also decreases. So this is the fifth factor, time of administration. Presence of disease. Next factor, drug like barbiturate, chlorpromazine may produce unusually prolonged effect in a patient having liver cirrhosis. Also, tryptomycin is antibiotics produce toxic effect on this patient. Their kidney function is not working properly because tryptomycin excreted through the kidney. In also diarrhea condition, absorption of certain drug is less. So presence of diseases. So kidney is excretory organs. Pharmacokinetics in that absorption, distribution, metabolism and excretion. So excretion is a very important parameters. If drug is not excreted properly, then it remains present in blood and they show a toxic effect. So tryptomycin, like if the kidney function is not properly working and the tryptomycin not excreted and they remains present in blood and they also produce toxic effect. Diarrhea condition, absorption of certain drug is less, means pharmacological actions, any drug administration that times decreases. Seventh factor, that is genetic factors. Deficiency of certain enzymes may produce hereditary disorders. For example, diabetes mellitus, drug allergies are also heritable, sulfa allergy, penicillin allergy. This is the genetic factors. Then 8 factors, environmental factors. Doses required to produce the action during the day and night may differ due to some physiological changes in body functions. For example, phenobarbital barbiturate required to produce sleep during daytime is higher than dose required to produce sleep at night. So phenobarbiturate is a hypnotic category. Hypnotics means nothing but it's a drug or substances which produce sleep. When drug taken phenobarbital in day, that times dose is more required as compared to night, because night is some sleep is naturally also occurs and that's why the dose is smaller required. So this is the environmental factors affect. Idiosyncrasy is also called as allergy. So what is this? An extraordinary response to the drug which different from its characteristics of pharmacological action is called idiosyncratic. Example, small quantity of aspirin may cause gastric hemorrhage. Some persons are sensitive to the penicillin, sulfonamide because they produce severe toxic effect. Extraordinary means aspirin is an analgesic, but aspirin cause gastric hemorrhage, that is extraordinary response, that is the idiosyncratic reactions. Then rate of eliminations or cumulation. So rate of elimination depend upon kidney. Kidney is working properly. Cumulation means accumulation of drugs accumulate in the body due to the slow excretion causing toxicity. For example, digitalis, chloramphenicol. If your drug is not excreted properly, then only drug reaches in blood and this shows toxic effect. That is the rate of elimination. Slower the rate of elimination, higher the toxicity. Higher the rate of elimination, decrease the toxicity. So this is the factors affect. Then drug tolerance. Tolerance means repeated administration of same drug decrease the responsiveness. Repeated administration of same drugs. Example in that, sedative and hypnotic drugs, phenobarbital, or sleep producing drugs, diazepam, etc. Phenobarbital, tolerance, repeated administration of same drugs or also alcohol. That times dose of that dose of responses that decreases when in first time, second time you need the more dose as compared to previous dose. Tolerance means repeated administration of same drug decrease the responsiveness of that drugs. When next time we taken that same drugs, we need more dose. That is the tolerance. Types of tolerance: true tolerance and pseudo tolerance. True tolerance, which is produced by oral and parenteral administration of drugs, and pseudo tolerance, which is produced only to the oral administration of drugs. So this is the difference. True tolerance, which occurs oral and parenteral administration of drugs, and pseudo tolerance occurs oral route of administration. Tachyphylaxis: when some drug administered repeatedly at short interval, the cell receptor get blocked up and pharmacological response to that drugs decreased. Then decreased response cannot be reversed by increasing the dose. This phenomenon is known as tachyphylaxis. For example, ephedrine given repeated dose at short interval in the treatment of bronchial asthma may produce very less response due to the tachyphylaxis. So tolerance, in that we increase the dose, that times they show the pharmacological actions. But tachyphylaxis, when we increase the dose again and again, once receptor get blocked, then pharmacological actions doesn't change or doesn't increases. So this is the basic difference: tolerance and tachyphylaxis. Tolerance means repeated administration of same drug decrease the responsiveness, but tachyphylaxis, in that some drug administered repeatedly at short interval, the cell receptor get blocked and pharmacological response of that drugs decreased. Next factors and last, that is metabolic disturbance. Changes in water electrolyte balance, acid base balance, body temperature, and other physiological factors may modify the effect of drugs. Salicylate means aspirin reduce the body temperature only in case of individual has rise in body temperature. They have no antipyretic effect if the body temperature is normal. Metabolic disturbance, in that changes in water electrolyte balance, acid base balance, body temperature, other physiological factors, or may modify the effect of drugs. Salicylate reduce the body temperature only in case of individual has rise in body temperature. They have no antipyretic effect. The body temperature is normal. So in these sections we learn about factors modifying drug actions. So this is the number of factors to how to remember. One trick is developed, that is Asbert PZ Ear SAT team. Asbert PZ Ear SAT team. You have to remember these initial words to recall of that overall factors. This is the main motive or main objective. A means age, S means sex, B means body weight, route of administration, time of administrations, presence of disease, genetic factors, environmental factors, acquired tolerance, idiosyncrasy, rate of elimination, excretion, synergism, antagonism, tolerance, tachyphylaxis, metabolic disturbance. So age, small child, you have to remember age, small child, and old people require smaller dose due to the improper development of kidney and liver functions as compared to adult. Sex, special care is required for women during pregnancy. Body weight, higher the body weight, higher the dose is required. Route of administration, in oral route, higher dose is required as compared to IV route, because oral route absorption is decreases, in IV route drug directly reaches in blood. So this is the route of administration. Time of administration, before the meal more absorption, more pharmacological action, but GIT irritation is occurs, and after the meal absorption is decreases but no gastric irritation. Presence of diseases like kidney diseases, tryptomycin, when kidney improperly working, at times tryptomycin doesn't working tryptomycin does not excreted, and that result in toxicity. Also diarrhea, lesser the absorption, that is the presence of disease. Genetic factors, environmental factors also, acquired tolerance, idiosyncratic, extraordinary response of drug, rate of elimination, more the elimination rate, decrease the toxicity, decrease the rate of elimination, higher the toxicity. Rate of elimination is also called accumulation. Synergism, synergism means administration of two or more drugs same time result in one drug increase actions of another drug, that is called synergistic effect. Synergism means simultaneous administration of one drug increase actions of another drug is called synergistic effect or synergism. And antagonism means when simultaneous administration of two drugs, one drug oppose the actions of another drug. Example, morphine and naloxone. When suffer from poisoning, that is morphine, the person suffer from morphine poisoning, that times naloxone is drug is antidote to prevent morphine poisoning. Antagonism means simply when simultaneous administration of two drugs, one drug opposes the actions of another drug is called antagonism. And synergism means when simultaneous administration of two drugs, one drug increases actions of another drugs. And antagonism means opposite each other. Tolerance means repeated administration of same drug decrease the responsiveness of that drugs. When increase the pharmacological action, that time dose will be increases. Tachyphylaxis, repeated administration of same drug, that receptor get blocked and pharmacological actions also doesn't increases, that is called tachyphylaxis. And metabolic disturbance, also these factors will modified. So today's lectures we learn about that. Thank you, keep reading, keep growing.